Hello, my name is Tracie Neely, and I'm going to be talking to you about my endocrine PowerPoint presentation. Today, I'm going to be talking to you about hypothyroidism. What that is a disease or one disease of the endocrine system. The contents of this PowerPoint include the introduction, the etiology of the disease, pathophysiology of the disease, health assessment findings of the disease, laboratory findings, common medications used to treat the disease, and side effects of the medication. Introduction. What is hypothyroidism? It is a deficiency in the production of thyroid hormone by the thyroid and an increase in TSA production. Now, the thyroid is actually two lobes that lie on either side of the trachea. And inside this thyroid, there are two types of endocrine cells. They're parafollicular and follicular cells. These cells help synthesize, secrete, and store the thyroid hormones. These thyroid hormones are T3 and T4. These hormones are essential to the growth, development, body metabolism, and function of cells and tissues throughout the body. These hormones also help aid with body temperature. Hypothyroidism also affects females more often than males. And when you have hypothyroidism, again, like I said, it's a deficiency in the production of T3 and T4. Know that thyroid cannot make T3 and T4 without iodine. So the etiology of the disease, that is what could be some of the causes for hypothyroidism. Well, one could be an autoimmune disorder. Such disorders could be Hashimoto's disease, and that's where the immune system makes antibodies that attack healthy tissues. You could have iodine deficiency. So like I said on the previous slide, when the thyroid can't make T3 and T4 without that iodine, it can cause the thyroid to be hypoactive. Another is loss of thyroid. And what could that be caused from? That could be caused from thyroid surgery, radiation therapy. Another is congenital hypothyroidism, and that is when a baby is born at birth with a non-functioning thyroid. Medicines such as lithium and amiodarone could lead to hypothyroidism. And then another one, which is rare but could happen, is when a failure of the pituitary gland to make enough TSH hormone. This could cause hypothyroidism. So the pathophysiology of the disease, again, is the antibody production destroying thyroid, which can be found in Hashimoto's disease. Inflammation, subacute thyroiditis, postpartum thyroiditis, iatrogenic hypothyroidism, which basically is the inflammation of the thyroid gland, and then absence of thyroid tissue, which could be caused from surgical or radioactive treatment. So now that we've looked at the etiology and the pathophysiology of hypothyroidism, how do we know if we have hypothyroidism? So how do we diagnose? What are we looking for? Some clinical manifestations could include loss of energy, bulging eyes, non-pitting edema, intolerance to cold, receding hairline, muscle aches. Late signs include myxedema coma. This is a medical emergency. Diminished level of consciousness is noted, hypoventilation, slow heart rate, hypoglycemia, thickened skin, and even cardiac complications, according to our textbook. So on health assessment findings, these are things that we need to do and we need to look at. So on the slide before, I talked about diagnosis and some clinical manifestations we need to look for. In order to do that, we need to evaluate our patient. We need to check for skin changes. So when I was talking about thickened skin, check for those skin changes, such as the thickened skin, the non-pitting edema, the bulging eyes, intolerance to cold. If you get to noticing that they're shivering, also assess for weight changes. How we would do that is you ask your patient, have you noticed any recent weight gains or losses lately, or within the last week? Have you noticed you have a decrease in your appetite? Assess for cardiac rhythm changes. We know, like, as I told you in the slide before, bradycardia is something that you would look for. That's a clinical manifestation. So we look and see, are the heart rates in the 60s, or is this a change from their baseline? Again, check for edema, and we're checking for edema in their hands, their feet. Also, don't be afraid to check the abdomen, because they could have changes in the abdomen, periorbital areas. Also, check and assess their level of consciousness. So when in the later stages or later crisis of hypothyroidism, you get to noticing that they have disorientation. These are things you need to look for. Also, a good reference is your Jarvis book, your physical examination and health assessment book. It shows there's a chapter in there's different chapters in the book that show you how to check for skin changes, the weight changes, how to check for edema, levels of consciousness, and each one is by system. So what are some laboratory findings that we need to look for? Well, one is a complete metabolic panel, or a CMP. You want to assess and check for changes in your electrolytes, such as the calcium level. A UA, again, to check for the excessive calcium in the urine. Thyroid levels. So hypothyroidism is a deficiency in thyroid hormones in the thyroid, and the thyroid produces what? T3 and T4. Also, check for your TSH. Remember, talking about the increased production of TSH as well. Also, EKG. The reason why we would do an EKG, we would assess the rhythm changes. See if they're having palpitations. See if they're having bradycardia, tachycardia. Another good one would be an anti-thyroid antibody titer. And this also could help see if the patient is exhibiting signs and symptoms of hypothyroidism. So now that we have identified that the patient has hypothyroidism, what do? Well, we've got to manage. We've got to manage and treat the disease. One of the treatment options could be hormone replacement. So medications and side effects. So as I said about hormone replacement, one would be medication would be levothyroxine, and this is a synthetic form of T4. This drug can be given orally. It also can be given IV or intravenously for myxedema coma. Side effects include excitability, tremors, headache, nervousness, insomnia, palpitations, tachycardia, angina, and cardiac arrest. Another medicine is the liothyronine or cytomel or triostat. This is a synthetic form of T3. It is given orally if given as cytomel, and it's given intravenously if it's triostat, and most commonly given if the patient is exhibiting myxedema coma. Side effects include jaw pain, double vision, chest tightness, decreased urinary output, and anxiety. And again, as I said on the previous slide, myxedema coma is a life-threatening emergency. So if you have a patient exhibiting these signs of hypothyroidism, such as hypoglycemia, they're having that lactic cardiovascular collapse and lactic acid doses, they need to seek immediate treatment, immediate care. Another medicine is Lyotrix, or the other name is Thyrolar. It's a synthetic mixture of T4 and T3. This is given orally. The side effects include dizziness, abdominal pain, back pain, headache, and pancreatitis. Some special considerations to ensure that your patient is aware is that they are being followed by their primary care physician and seen on a regular basis when taking these medications. They need to be knowledgeable about the importance of how this medication works and why labs or routine laboratory values need to be performed. You also need to instruct your patients that they need to watch and avoid iodine-containing foods when taking these medicines. Iodine-containing foods include soy sauce, iodized salt, yogurt, milk, strawberry, eggs. Also, you need to teach your patient that, especially if they're diabetic, to monitor their glucose levels closely, that taking these medications can cause a fluctuation in their glucose. Also, you need to instruct your patient to weigh themselves. Check to make sure that they're not having weight changes, pulse rate changes, intolerance to cold or heat, diarrhea, constipation. And if they exhibit these, they need to seek medical help. In conclusion, hypothyroidism is when there's a deficiency in T3, T4 hormones or thyroid hormones in the thyroid. The cause could be secondary or primary. Remember that the thyroid needs these hormones in order for the body to function, regulate, and keep up with metabolism and for growth. Know that if hypothyroidism occurs, a patient could exhibit signs and symptoms such as extreme fatigue, cold intolerance. They could also have a decrease in level of consciousness. It is important to seek medical assistance immediately if they exhibit these, especially when they have decreased level of consciousness, hypoglycemia, and lactic acidosis. There are several medications that are able to help with this disease, such as Synthroid and other hormonal therapies, making sure that special considerations are being followed and cared for by the PCP. Remember that it's important to let your patient know that they need to be seen routinely and to have labs followed routinely. This disorder is treatable and manageable, and if the regimen is being followed according to your doctor, there won't be any crisis and won't lead to death. I hope that you've learned a few things about hypothyroidism, such as the etiology, the pathophysiology, some of the medications and their side effects to help treat this disorder or this disease. Here is a list of references that were used to make this PowerPoint. I do appreciate it, and I hope you have a great day. Thank you.